Autoimmunity involves the body attacking its own tissues. This occurs because heavy metals, xenotoxic chemicals, or stealth pathogens attach to body proteins or enzymes, eliciting an abnormal foe response, marshalling the T killer lymphocytes to destroy potential enemy protein or enzymes. There's 3 issues to deal with in autoimmunity reduction. Eliminate the toxins, heavy metals, and the stealth pathogens. Then clear all secondary free radical singlet oxygen, hydroxyperoxyl radicals, and nitroperoxyl radicals, and cytokines released by the angry attacking macrophages and the activated T killer lymphocytes. The 3rd phase is tissue rebuilding with biomolecules, hormones, and hormone precursors to support the stem cell regeneration. This requires an abundance of bioavailable nutrients, minerals, amino acids, fatty acids, and signal via telomerase to activate the mRNA production in the endoplasmic reticulum outside the nucleoplasm of the new regenerative structural proteins and enzymes. If all 3 phases are accomplished and continued to be supported, and inciting allergic signals that incite the destructive immune behavior and free radicals, and the autoimmune abates, then the person can heal. Curcumin inhibits the autoimmune diseases by regulating inflammatory cytokines like interleukin-1 beta, interleukin-6, interleukin-12, TNF-alpha, and IFN-gamma, and the associated JAK, STAT, AP1, and the NF-kappa B signaling pathways in the immune cells. Typical doses of curcumin can range from 1 to 5 grams per day. However, due to its low bioavailability, it should be consumed with either BioPerine, which is a black pepper extract, or else taken with a fat like coconut oil, butter, ghee, or fish oil in order to increase its absorption. Resveratrol is found in tiny amounts in red wine or Japanese knotweed. Anti-inflammatory, antioxidant, and anti-aging properties of resveratrol have been reported, and in some animal and human studies, this compound reduced and ameliorated the progression of autoimmune diseases, such as rheumatoid arthritis, systemic lupus, erythemus, psoriasis, inflammatory bowel disease, and type 1 diabetes. Typical doses are 500 to 1000 milligrams per day in the stable form trans resveratrol. There's data to suggest the resveratrol consumption may lead to a 7% increase in lifespan. Other supplements that show even higher capacity of extension in lifespan are olive oil consumption, and the most promising compound being charcoal. This use of charcoal supplementation is very interesting, as it implies one of the most important factors to life extension is the removal of toxins from the body, and it indicates nutritional status and supplementation may not be the most important aspect of health and longevity. Charcoal could be very beneficial for an autoimmune condition, also as the toxins are indicated in pathology. Typical doses of charcoal are 500 milligrams of activated charcoal taken first thing in the morning on an empty stomach, at least 2 hours before food. You could see my video on DHEA, berberine, and growth hormone for more ways to potentially extend your lifespan. Glutathione is considered the body's master antioxidant, and we know that you need it to dampen autoimmune diseases and to lower your risk of developing new autoimmune diseases. Glutathione works by protecting energy production factories inside the cells called the mitochondria. Healthy glutathione recycling is also a vital tool in managing autoimmune disease. Glutathione recycling helps to repair a leaky gut and protects it from permeability. Leaky gut can lead to or exacerbate autoimmunity, multiple food sensitivities, and chronic inflammation. There's numerous ways to increase glutathione levels, such as by supplementing with reduced glutathione at up to 1 gram per day, taking N-acetylcysteine at doses of 500 milligrams 3 times per day, taking the herb milk thistle, or eating asparagus. Correct any selenium deficiency by consuming 200 micrograms per day, or 3 Brazil nuts. The supplement oral S-acetyl-glutathione, when dosed at 200 mg per day for 7 days, when compared to an intravenous dose of 1,400 mg, was found to be superior. Therefore, it would be recommended that S-acetyl-glutathione with N-acetylcysteine and selenium may provide the best results. A lot of times the people use L-glutamine because it increases the support of the immune system and it decreases intestinal permeability. It's often supplemented with when someone has a leaky gut or an intestinal autoimmune disease like Crohn's or celiac. One other immune-boosting formula for a leaky gut is enzymatically preserved colostrum due to its high immunoglobulin content. Research and clinical experience has shown that some patients with autoimmune disease have significantly altered intestinal environments, particularly those with autoimmune conditions involving the gut, such as inflammatory bowel disease, and that the addition of probiotics may indeed help to reduce the symptoms. The most effective probiotic mix that I know is called VSL3. You can also consume fermented foods like yogurt, kimchi, kombucha, kefir, and sauerkraut. Prebiotic fiber can also help to balance and to feed your good probiotics. You could also adopt a Candida diet and use Candida supplements to help to eliminate a Candida overgrowth that is also implicated in autoimmune disease. You could check out my video on Candida for more information about this. A vitamin D deficiency is known to be related to the development of autoimmune diseases. In particular, vitamin D deficiency is related to the development of and the severity of rheumatoid arthritis. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiency. High-dose vitamin C therapy is a powerful anti-inflammatory and it's used for people that have chronic autoimmune diseases, infection and cancer. High-dose vitamin C may be given intravenously or orally. If you can't get intravenous vitamin C, the best form with comparable results is liposomal vitamin C. You can see my video on liposomal vitamin C to see how to make this cheaply and easily at home. Vitamin K plays key roles in different physiological functions such as blood coagulation, bone metabolism, and the regulation of some enzyme systems. It can also act as a cofactor for some plasma proteins, thereby affecting immune and inflammatory responses, particularly mediated by T cells. There's evidence that vitamin K2 supplementation reduces inflammation in rheumatoid arthritis by reducing the CRP levels. Vitamin K2 may induce apoptosis in rheumatoid arthritis synovial cells. Dr. Weston Price, who studied traditional diets, labelled vitamin K2 as Activator X due to all of its potential benefits to health and longevity. Typical doses range from 100 to 300 micrograms per day in the form of MK7. Zinc has protective effects against autoimmune conditions in which the body starts attacking healthy cells. Zinc is needed to trigger the activation of infection-fighting T cells. These control and they regulate immune responses, and they attack infected or unhealthy cells, helping to ward off infections and disease. T cell function is highly zinc dependent, and this mineral is needed for the transformation into either killer cells or helper memory T cells, which help the immune system to remember a given pathogen should it encounter it again. Zinc also fights infection by subtly reining in the immune response to stop it spiraling out of control and causing excessive inflammation in the body. Typical doses of zinc range from 30 to 50 milligrams per day. Be sure to get a bioavailable form, as many forms of zinc have poor bioavailability. Zinc absorption is enhanced when taken with the bioflavonoid quercetin, which is naturally found in elderberry juice. This flavonoid also enhances the effect of vitamin C. Gamma-linoleic acid found in borage and evening primrose oil reduces inflammation. Some studies even suggest that gamma-linoleic acid protects the DNA. The body converts much of the gamma-linoleic acid taken as a supplement to a substance called DGLA, and this fights inflammation. Typical doses of borage oil are 1000 milligrams taken 3 times per day. Nascent iodine may be beneficial if your autoimmune is related to hypothyroidism. However, it may make matters worse if you're suffering from hyperthyroidism. You could check out my videos on hypo and hyperthyroidism for more information about this. A magnesium deficiency may cause increased production of inflammatory chemicals in the body, raising your inflammation, contributing to autoimmunity. Most people are deficient in magnesium. The best form to take would be magnesium bisglycinate. You can start to slowly increase your dose until side effects like diarrhea and stomach discomfort are noticed, then gradually reduce until you determine your maximum tolerable daily amount that does not cause any side effects of the stomach discomfort. As magnesium is required by over 300 processes in the body, it can have profound benefits after a few months of supplementation. Taken in supplement or food form, omega-3 fatty acids have been found to reverse the progression of a number of inflammatory diseases, from inflammatory bowel disease to diseases of the skin and the joints, and other autoimmune diseases such as lupus and multiple sclerosis. Typical doses of omega-3 are 3 to 9 grams per day of a molecularly distilled EPA-DHA fish oil blend. Beta-glucans appear to act as an immune system modulator, and they may also help autoimmune disease. As well as eating more oats and shiitake mushrooms, you can get supplements of purified beta-glucans. It's since been established that the complex, integrated immune system needs multiple specific micronutrients, including vitamin A, D, C, E, B6 and B12, folate, zinc, iron, copper and selenium, and these play vital, often synergistic roles at every stage of the immune response. When supplementing, make sure to use a quality form of B12, such as methylcobalamin, folate as 5-methyl tetrahydrofolate, a non-synthetic form of iron, a yeast source selenium, a mixed tocopherol natural form of vitamin E, vitamin D in the form of D3, vitamin K in the form of K2, MK4 or MK7, and carotenoids from food sources. Cheap synthetic vitamins may not only be useless, but some evidence seems to suggest they may negatively impact your health. MTHFR mutations are relatively frequent in the population. The MTHFR mutation is also believed to predispose a person to certain cancers, birth defects, and autoimmune diseases. Every cell needs adequate methylation for its normal growth and repair. Methylation helps the body to detoxify and to eliminate potential dangerous substances. Proper methylation is particularly important for the brain and the neurotransmitters that influence mood. How this basically translates to your health. It means if you're under or over methylated, you require different nutrients and you should abstain from some supplements. You can find a list of mental health symptoms that are associated with both under and over methylation, and this can help you to easily determine if you're on either side of this imbalance. An example, undermethylation is also associated with a range of psychological and psychiatric disorders, such as migraines, allergies, sleep disruption, mood regulation, memory problems, depression, and schizoaffective or bipolar disorders. But this can easily be treated by taking a multi-B vitamin plus a B12 as methylcobalamin, folate as methyl tetrahydrofolate, and sulfurous compounds like DL-methionine and trimethylglycine. The MTHFR gene polymorphism is also a factor that can increase the toxic burden on the body, increasing the damaging products homocysteine and the stress hormone cortisol. Other toxins are also implicated in immune dysfunction. See my video on mercury amalgam fillings for information on another possible source of contamination, and candida for the toxins that can be released from the yeast overgrowth. Also, leaky gut which can interfere with gut permeability that allows toxins in the food to enter the bloodstream. Start to eliminate artificial sweeteners and flavour enhancers such as aspartame and MSG. I've shown more information on the damaging effects of these in my polymyalgia, fibromyalgia and chronic fatigue videos. Chemicals like bisphenol A found in plastics may contribute to autoimmune disease, and in my video on the menopause I show the link between using non-stick frying pans triggering earlier menopause. Some of the most effective detoxifiers have already been discussed here, being glutathione, N-acetylcysteine, milk thistle, selenium, vitamin C and MSM. Other agents are charcoal, zeolite and other clays such as bentonite clay. The anti-inflammatory protocol diet is an elimination diet designed to help to reduce inflammation or other symptoms caused by autoimmune disorders. It's comprised of 2 phases designed to help you identify and ultimately avoid the food that may trigger the inflammation and the disease-specific symptoms. Elimination of gluten, for example, can be a great help as it can trigger all sorts of immune reactions. There's some who speculate that this is not just due to the gluten intolerance or the gluten sensitivity, but it may also be due to the high amount of glyphosate, Roundup weed killer, that can be found in wheat and other non-organic food. Many autoimmune disorders cause muscle and joint pain, which can interfere with sleep. A person's immune system may attack cells that are involved in sleep processes. Researchers recently determined that narcolepsy, a condition in which people fall asleep suddenly and without intention, is an autoimmune disorder. You can check out my video on herbs to help sleep for some info on supplements that may help to promote a normal circadian day-night sleep rhythm. You should avoid caffeine and stimulants, as they may seem helpful at the time, but they stress out the body and are deleterious in the long run. The 2 main things for increasing energy in the day are fixing hypothyroidism, such as with nascent iodine supplementation, or the research chemical SR9009, which was designed as a cure for jet lag, and it seems to be one of the only compounds available that makes your body dump old damaged mitochondria. And it also has promising trial results and improving many autoimmune conditions like IBS and Crohn's disease. Patients with mitochondrial disease can have issues that are related to the decreased production and the function of the body's white blood cells and antibodies that are needed to be generated to fight infection. You can check out my video on mitochondria boosters and endurance boosters for more information about the mitochondria and its ability to generate adenosine triphosphate, the energy source in the body. As there are at least 80 different kinds of autoimmune disease, be sure to check out my website to see if your condition is covered in one of my videos. For example, natural treatment and support protocols for multiple sclerosis, chronic fatigue, type 1 diabetes, asthma, Graves' disease, polymyalgia rheumatica, fibromyalgia, rheumatoid arthritis, and psoriasis have already been covered by me. To learn more about the herbs or the supplements discussed in this presentation, go to my website.